Dr. Leigh, I would like you to tell us about the different option of whitening your teeth or bleaching your teeth. And I want to go over, I want you to please include us the option of going to the pharmacy and buying over-the-counter strips and all that stuff is out there in the office where you make the custom trays, including that new but not so new. It's been around for a while, this laser cleaning where, you bleaching, where you kind of like in an hour or so are fully done. Shed some light on all three of them, the pros and the cons, please.
Sure. The over-the-counter whitening is it works for some people. It's just a lower concentration of bleach, and a lot of times the strips it may cover maybe 6 teeth in the front at the most. So if you're looking to whiten in all the teeth that show when you smile, you need a custom-made tray so that you can whiten all those teeth that show. So the difference between doing the over-the-counter is you're not going to whiten as many teeth, and it's a lower concentration, so you may have to use it a little bit longer, or you may not get the results. But for some people, it works fine. We also sell the white strips in our office, and that's a higher concentration, but again, it only covers the front 6 teeth. So for some people, it's fine. We offer a chair-side whitening, which is a even higher concentration, where we do it in the office for an hour. And the reason for doing it in the office is because we have to control the whitening material because it's very strong and it works, and you get such a dramatic effect in a short period of time that, again, you need to be in the chair so that we can make sure it doesn't really touch the gums. And for that process, we do make what's called a whitening tray that you wear, and you also take that whitening tray home and you use a lower concentration so that you can get a long-lasting effect. Because if you just do the chair side for 1 hour, you'll get a quick effect, but the shade or the color of the teeth it won't last as long as if you do the whitening at home for, say, 2 or 3 weeks, and where you literally sleeping with the whitening tray in your mouth, and it's very thin and soft and comfortable. So a lot of times you're not even aware that you're even wearing it. But really, to get a good whitening effect, you have to wear the trays for at least 2 to 3 hours at a time. And we do encourage patients to sleep with them in their mouth.
I see. So basically. And then that would depends on how much shade you want to achieve, like how yellow have they been or brown, and how white you want to get them. It's about a couple weeks and maybe a little more.
Yes, if you want to, and then from there you may do a touch-up maybe every 6 months to a year where you may whiten them for maybe 3 to 5 days. And everyone's a little different as far as how the teeth respond.
Yeah, that's a good point, because most likely whatever made our teeth brown, except if they're naturally very brown, and I'm not even sure naturally brown teeth can be whitened or bleached. Tell us, can they?
Well, we've gotten some pretty surprising results where if someone's had, for example, tetracycline staining, where they were given tetracycline as a toddler for any infection, that actually will make the adult teeth that are still developing discolor, where you have basically gray and brown lines going across your teeth. We've gotten pretty good results, using the system that we use in the office. So there are some options for it without having to crown teeth or even do veneers.
Got it. So let's assume, a person drinks coffee like I do, espresso, or red wine, or smoking or whatever. It changes out that after he bleaches his teeth, he isn't changing his lifestyle, because we barely do it when we lose weight, right? We go on this weight loss binge, and then we go straight back to the whatever we did, which put it on, right?
Right.
So can a person every few months bleach it? So it's not like a bypass where there's only so many you can do. In this case, you just can keep doing it, right?
Yeah, sure, absolutely. And and if you are a red wine drinker, a coffee drinker, sometimes you get the best effect. Just make sure you have a dental cleaning before you do your touch-up whitening.
Which brings me to a question here. I have heard that, and that seems to be applying, especially when you go to over the counter and you buy whatever you buy there. And it seems to be the main difference is it's not so strong, so you might have to wear it a lot longer to get the results. That's basically the main idea behind it, right? So let me ask you, so anyway, there's apparently when you bleach your teeth, if you have a filling or, some, aluminium, or whatever you have on it, anything which isn't natural, it will not bleach. So if you don't remember that you had a filling 10 years ago and this and that, you might all of a sudden have a little checkered mouth, and it may look worse than before, where at least it was yellow, but it was equally yellow. Is that kind of the truth?
Yeah, and sometimes you have to replace a filling.
Right, when people go and do their bleaching, and if they do choose to start with the over-the-counter thing, which is cheaper, maybe they should at least go and tell the dentist and say, can you check, so the dentist can tell them, look, you have 3 fillings in there, you're going to look ugly. You need to at least know you need to come in afterwards, so don't be shocked when you wake up in the morning and all of a sudden look like some police car which is, lighting up. Right? Yeah,
I mean, if you forgot about that, exactly. I mean, if you forgot about that filling, then you're going to be reminded of it 2 weeks later, potentially doing that whitening. So yeah, I mean, it's not a huge thing to come in, and we could just check real quick and just to save you any aggravation in the future. If it's better to know as opposed to any surprises,
before, right?
Yeah, exactly.
So that this is coming up, because otherwise, for some reason, financially and time-wise, you might not have planned it. You go and say, I'm going to that wedding day I want to have, and then the time comes around and you get checked teeth. Now you need to spend a few $100 on the filling and some time, maybe. And next thing you know is so you better know before. Good.
Absolutely.
Wonderful.
Yes.
All right. So wonderful. So we can bleach teeth over and over. So that's a very good free ticket, a carte blanche to drink coffee, wine, and smoke. I love it.
Yes. Party on.
Party on. All right. Bye, Dr. Leigh.